I would like you to explain complexion problems, Dr. Ghatan. Is that age, elder people, younger people more prone to it? And how can it be fixed?
Well, it can happen in any age. A lot of times, it's more commonly seen in dark-skinned people, because often there is a precedent problem, such as, say, acne or eczema or other rashes, or just from rubbing the skin over time and rubbing and stimulating the extra production of the melanocyte, the pigments by melanocyte, you're going to cause discoloration, which you call a hyperpigmentation. And that gives an uneven tone, and people are very distressed about it, it can be very disfiguring at times. It can also happen in ladies who become pregnant. They get these dark spots on the face, on the cheeks, on the forehead. That has to do with hormonal changes and also with sun exposure. So, fortunately, we do have effective treatments for these conditions. We do recommend people to use sunscreen to begin with. We do find that it's much more effective to use a combination of treatments, and by that I mean use of topical depigmenting cream, and there are a wide variety of them in the market, and there are over-the-counter medications as such, but we often find those over-the-counter depigmenting creams, hydroquinone they call them, very risky. They can cause more problems than solve them. It's best that these kind of problems be taken care of under supervision of a experienced dermatologist. And we do use oftentimes hydroquinone, sometimes combined with other medications, and we find it more effective. In our experience, we've been using the cream and together with microdermabrasion, which is done in the office. Microdermabrasion is basically a powder that is a little bit abrasive, not painful, and some suction that is applied to the skin, and it will go over the whole entire face, or if it's on other parts of the body, it can be done on other parts of the body as well, on the neck and arms and legs, other parts. And over a period of time, we do see that patients get more even tone, the complexion problem is resolved, and they're very happy. People who have acne, we tell them you need to treat the acne to get rid of the acne, and also to avoid getting these dark spots from acne. So you have a two-pronged approach. We help them with the acne and with the dark spot. In this situation, microdermabrasion is effective and helpful for both acne and the dark spots. The other thing that we can offer the patient is chemical peel. And the chemical peel have to be used with caution because they can be sometimes strong and they can cause chemical burn. So we use a percentage of the chemical that is safe, specifically for the dark skin people, which is more prone to damage from this chemical. And again, the chemical peel is done once, say, every 2 weeks or so, and gradually one gets more even tone and even color. Now, there are people who have, and a lot of people have, this dark pigmentation, what we call orbital hyperpigmentation, periorbital hyperpigmentation, dark circles around the eye. We have been successful to treat those with a specific chemical peel in office, especially for very bad cases. We've been very, very successful with that. We do have creams that we also use that help with these dark circles and also the puffiness to some extent, and fine lines under the eyes are also improved with these topical medications. But for very serious cases, we offer them the chemical peel, which is quite effective and satisfying.
Well, that's a lot of data. We'll probably have forgotten everything by now, about it. But so basically, there is some hope. There is some help for uneven colors and complexions in the face. Most people are worried about it in the face. Are there other parts also?
Yes. For example, in the ladies, on the legs, especially on the forearms, the hands, if they have dark spots, sometimes they get it on the knuckles and the dorsal of the hands. So yes, then it could be helped. Sometimes they get a burn on the arm from cooking a lot of times, and that causes the discoloration. That could be also helped with this treatment.
Okay, wonderful. Thank you very much, Dr. Ghatan.